Good afternoon, everyone. I'm Dr. Gregory, a physician here at Moreland OB-GYN, and I wanted to take a moment to speak to you all about updates regarding the COVID-19 vaccine and the program rollout that's currently going on in the state. We'll start off by what vaccines are available. Currently, there are 3 approved vaccines for the United States. You may hear about many others that are available outside of the country, but currently we have Pfizer, Moderna, and the new Johnson & Johnson vaccine that just is now coming online. Pfizer and Moderna are what we refer to as mRNA-based vaccines. They have tiny pieces of genetic material that tell your cells how to build one of the crucial proteins to the COVID-19 virus. They will not build an entire virus, and it can in no way infect you, but they build one tiny protein that's critical that your immune system learns to recognize and then helps you fight off or avoid illness in the future. The Johnson & Johnson vaccine is similar in that it helps your body encode one of those proteins, but it does it through a more traditional route using what's called an adenovirus vector to get that information into your cells. The important thing about all of these vaccines is none of them can cause an actual infection. You may feel like you have the flu or have a cold, but you're not infected with anything other than the protein that your body needs to learn how to fight this virus. Next, I want to talk a little bit about their efficacy. When the first 2, Pfizer and Moderna, came out, they were reporting efficacies as high as 95%, which was really exciting. Our goal generally is 70 to 80% effectiveness for a population-wide vaccine. This doesn't mean that only 5% of the population got the illness, but it does mean that only 5% showed any symptoms of the illness. So there's a potential for asymptomatic infection, but that still appears to be very, very low. Now, you may be hearing that our 3rd vaccine, the Johnson & Johnson, is less effective, but it really depends on what we're looking for. Are we looking for absolute absence of the virus, or are we actually looking for preventing serious illness? The initial reports showed Johnson & Johnson was 67% effective in preventing moderate or severe disease. And when they dug further into those numbers, it actually is almost 95% effective in preventing hospitalization. That's truly the goal here, is to prevent serious illness and death from the virus. So it doesn't mean that there won't ever be COVID-19 around, but it does mean that those of us who do eventually get it, we may only have a mild illness. COVID is here to stay, and we're all going to have to learn how to deal with it. One of the most important aspects of deciding whether or not to get the vaccine is a discussion of safety. That's been forefront in everybody's mind. And we all understand in healthcare that patients are reassured by a long history of a specific treatment and knowing all of the side effects and exactly how that's going to work. Unfortunately, the pace of this pandemic has not allowed us that traditional pathway. So we have had vaccines that have been developed in a record times, and for good reason, because we were facing a record disease burden. That being said, we don't have long-term safety data on this. We know that these types of viral vectors and mRNA-based vaccines are safe from a theoretic standpoint, but we haven't had time to watch what happens to people over a long period of time once we get this. So then we're left with a balancing act. We have to balance the risk of getting COVID and the very real serious illness that it can cause with the theoretic risk that potentially the vaccine may have a side effect. We know that in the general population, 5% of people who get COVID will end up severely ill and in the hospital. And we know that 1% of the entire population that gets it will die of COVID-19. That statistic has not changed much since it burst onto the scene. So we really have to think about, is there a theoretic risk to the vaccine that is that serious? And so far, we have no indication that there's any risk even remotely approaching the level of risk inherent in getting sick with COVID-19. So that's the first step. The second step for a patient then is to think about what is their exposure risk. Are they working outside the home in close contact with the public or in close contact with sick people like healthcare workers, daycare workers, and teachers that see lots of kids who may not ever show symptoms of the disease but may be able to carry it? So once you think about your exposure risk, and then you think about the risk of actually getting the disease, and then you think about your own personal risk factors, whether you have high blood pressure, asthma, pregnancy, or any other of a large list of complications, what risk does that pose to you overall? And everyone must balance those risks against the risk of the vaccine. One very important thing that came out recently was we learned that people that are overweight and obese die at twice the rate from COVID-19 as someone identical to them who has a normal body weight. That was eye-opening for many of us, and so I think it behooves us to take a strong look at what our risks are, talk to your physician if you have questions, and ultimately determine what is right for you, because this really is a personal decision. There is no right answer for any large portion of the population. I personally am a big proponent of the vaccine. I rolled up my sleeve the minute it was available, and I told my parents to roll up theirs as well, which they did. Because for us, that seemed the most appropriate, least risky thing to do. But that may not be right for you, and we appreciate and respect your opinions on that. We just want you to go through the process of thinking about it and have that discussion with your physician so that you can make the informed, right decision for your own situation and the situations of all your family.